Well, I'm very excited to talk to you today about really a phenomenal therapy. Over the years, I've had the honor to get to know the Pointer sisters, and Anita and Ruth, and I don't know if you guys remember something, but about in the year 2000, we're going to have a little music to wake everybody up. And the basis of the talk is that stress causes inflammation. Inflammation accelerates aging. And stress can be both effectively measured and quantified using heart rate variability. How many people here use heart rate variability in their practice? Great, great. And again, the results of this UVL-RX therapy, polychromatic light therapy, showed a great improvement in heart rate variability, and therefore has been shown to have great therapeutic value in treating patients. You know, we go to these conferences to find out how we can help our patients. I think about 10 years ago, and I've been gone for about 20 plus years, I remember when we went to a tent here in Las Vegas to see the A4M. But about 10 years ago, I switched into thinking, well, I'm going to go to this conference to see how this can help me. And I think that if we help ourselves, I think our patients naturally benefit. So again, I would encourage everybody to seek out somebody who is doing UVL-RX therapy or polychromatic light therapy because we all carry a pathogenic load. We all have a certain amount of bugs, viruses, bacteria, yeast. This is a very effective therapy to reduce that.
First of all, this is my 12th year as a member of the A4M, and my first meeting was down in Florida several years ago, and it's incredible the growth of this. And one thing that I really appreciate that they've done now is incorporating a lot more of the aesthetic treatments. I'm a board-certified plastic surgeon, and I can see how we're starting to realize that as we grow our health from the inside using the anti-aging techniques that many of you perform in your integrative practices, we're starting to provide information now in the A4M on what we can do from the outside, and it's been just the last several years, and Dr. Bitter just gave a tremendous talk about some of the devices that he uses and the way we can rejuvenate the skin. But I sort of have also a unique approach to it, because as a board-certified plastic surgeon, I do surgery, I do deep lasers, do superficial lasers, and one thing that I've incorporated in my practice is the anti-aging component of it. So we do a lot with nutrition and wellness, and I think all of these things come together.
Okay, I'm Dr. Patrick Bitter, Jr., dermatologist, honored to be here at the World Congress of Anti-Aging Medicine. This has been a great congress, hasn't it? So I appreciate those of you here to join me in the afternoon. I really want to make my presentation very worthwhile for all of you that have decided to be here. And so even though the title of my presentation is Treatment of Inflammatory Acne with Broadband Light, I really want to expand that and share with you what we know, in 2017, starting of 2017, what we can do with light in treating the skin. I've been called the, in disclosures, let me just go back. I do train and lecture for a company, Cyton, a medical device manufacturer that does make the BBL device. So I've been called the, Godfather, the Babe Ruth, the rock star, the world expert in IPL treating skin. And I'd like you just to know that I've been a dermatologist for 31 years. I have been a person just simply willing to take my passion for wanting to make skin look as nice as I could for patients. And I was willing to take these IPL devices and BBL devices and flash them over 10.
But anyway, my name is Rebecca Gelber. As she said, I do practice in Lake Tahoe. And my practice is generally focused on doing larger cases with combinations of therapies and trying to get people the biggest non-surgical treatments I can in beautiful Lake Tahoe, where one of my biggest limitations is people don't want to be out of sun. Does anybody have that issue in their practice if they do lasers? It can be a real problem. So a lot of what I try and do is try and get people bigger results in smaller sessions with less downtime. Great, thank you. Okay. So what the study was is I took a look at what I used to do, which is a combination of IPL or BBL technology with a standardized ablative fractional method. And I think this is a very common technique that people put together. You get an opportunity to work on multiple of patients' concerns. However, one of the limiting factors was downtime. People did not like walking out of the office with a whole bunch of blood streaming down their face. Their husbands didn't like it, or their wives didn't like it either. So once a new laser came out that offered possibility of similar results, but potentially with an easier downtime, I started taking patients who had done previous treatments with me and comparing that, and got some very interesting findings. So anyway, what do our patients want? When they come into us, especially when they're undergoing lighter energy-based.
So anyway, I'm so grateful to A4M, Dr. Baker, Amy, and Janet for having me here. I'm going to be speaking today, as Dr. Baker said, on some really exciting work I've been doing with a brand new hybrid laser technology which uses both ablative as well as non-ablative lasers in a single session to provide just some really wonderful results, and then evaluating whether on top of that synergy, the synergy between an ablative and a non-ablative laser, whether there could be further benefit safely obtained by adding to that either IPL or BBL, which is a variant of IPL, but has also been noted to have some degree of anti-aging improvement. And just so people don't have to suffer through feedback through the whole talk, would you like to do any further adjustment of the microphone or turn me down? Because I can absolutely project to this room if we need to go without it. Wonderful, because I hate listening to feedback when I'm in the audience, and I hate inflicting.
We can't hear you back here.
You can? Okay. Let's just get fixed to the beginning rather than playing around with it throughout. Now can people in the back hear me? Nope, still. Are we getting there? Yeah. Okay, fantastic. And if we need to adjust that balance, we'll do that. So anyway, all of those things. So I'm going to be talking, as I said, about that combination. So what do our patients want? Because if we can figure out what our patients want and deliver it to them, you will always be successful. And when it comes to skin, I suspect wherever you are, whatever your practice is, whatever your demographic, the patients are coming to you saying the same things. They want better color. They want less browns and less reds. They want their skin to look even. They want snappier, more elastic skin.
It's not blotchy and hyperpigmented. It doesn't have ruddy tones. It doesn't have dilated capillaries. It doesn't have deep, saggy, folds. That skin is clear, it's smooth, it's tight, it's bright, and it reflects a lot of light back at you. So everybody in this room can look and say, he's not 80 years old. He's 5 years old. You may not know he's 5 years old, but as you look at the picture, you know he is a child. And if I showed you this picture and he had lines around his eyes, and he had deep nasolabial folds and blotchy brown age spots and large pores and wrinkles, you'd look and say, and I told you he was 5 years old, you'd say something's wrong with that 5-year-old. How many of you have children? So, and if you have children below the age of 20 or so, I've got 5, and 3 of them are over the age of 20. So, but when you look at your children, this is what you see. You see a round, full face and bright skin. That's what our patients want. That's what we want. We want that bright skin, that brightness of youthful skin. Now, as we age, skin no longer is as bright. And I will explain to you how light-based treatments work in making skin look younger and making it look healthier and making it look better, how exactly that works. And we got some of that from Dr. Zimmerman explaining really the interaction of laser light and intense pulse light or broad spectrum light with tissue. So these are my opinions, and this is one of my opinions, and that is that currently there's no skincare product, none, on the face of the earth, no matter how much you pay for it. There's no cream in a jar and there's no bioidentical hormone regimen or therapy or supplements or vitamins that you or I or our patients can take that will make as much difference in the way your skin looks as one well-done broadband light or IPL treatment. So now that's my opinion. You can put people on a regimen of bioidentical hormones, and it definitely makes a difference in terms of your vitality and how you feel, and it does make a difference in your appearance, but it won't do what one well-done treatment will do. So in 2014, we currently have the ability to and the technology to be able to really make aged skin look younger and make it look better. We've got the ability to take aging changes in the skin, bless you, aging changes in the skin and reverse those aging changes. But we also now have good science to support, and we've got the technology that we can slow down skin aging, and we can possibly reduce the likelihood of skin cancer. We don't have the data yet to be able to tell our patients that these light treatments that I'll be talking about reduce the likelihood of getting skin cancer, but all the anecdotal evidence seems to be suggesting that one of the benefits of getting regular maintenance, broad spectrum light treatments is